Hi, I'm Dr. Brett Langston. I'm a prosthodontist and the owner at Dental Implant and Aesthetic Specialists located here in Brookhaven, Georgia, and I'm here to help you watch your mouth. When you're missing a tooth, you have a couple of options for tooth replacement. One option is to do an implant, and a lot of times a single tooth implant is the best solution. The advantage of a single tooth implant is that it goes right in the space that you're missing. We don't have to touch the adjacent teeth, and it's just a single solution for that problem. A lot of times, however, if an implant is not an option, whether it's due to bone loss, medical history, just location of where that missing tooth is, we have to look at other options. And so your other option to have something restored that stays in your mouth that doesn't come in and out is called a dental bridge. And so a dental bridge, there's a variety of different types depending on the location of the missing tooth and also depending on the material that we use and depending on what kind of attachment we use to the adjacent teeth. We'll start with the simplest, least invasive type of dental bridge, and that's called a Maryland bridge. And it's not based on the thing that just happened. It's actually, the technical term is a resin-bonded fixed dental prosthesis. And so basically what this is, and usually we use it when you're missing a lateral tooth. So these are your two centrals, the two big teeth in the middle, and it's very, very common. And in fact, the most common missing teeth are the lateral teeth. And a lot of times we'll see it in children. They get the baby tooth on the side, and they get the two big teeth on either side of it. And then as they get older, all of a sudden that baby tooth comes out and they don't have their permanent tooth behind it. And we don't do implants. We try to avoid implants on anyone under the age of 21, guys even to 22, 23, just because we don't know where the growth is and we don't want to put something in that's not going to last for a long time aesthetically and functionally. The solution there is to do a Maryland bridge. And what that is basically we reduce the back side of the teeth on either side, or sometimes just one tooth next to that missing space, and we make a fake tooth, typically out of either zirconia, which is a white metal, or sometimes we use gold, which is a foundation gold, which is a silver-looking metal, and you have a tooth-colored fake tooth, and then you have a wing that hangs off the backside. And that wing is bonded to the backside of the tooth next to it. So when you smile, it looks like you've got a natural tooth sitting there, but it's adhered to the backside. The advantage of a Maryland bridge is that we don't have to change the front of either one of the adjacent teeth. And so really it is just a very simple additive procedure. In fact, a lot of times when we do Maryland bridges, we don't even need to get the patient numb because we're just making a little bit of a modification on the backside of those teeth with a high-speed burr, and there's no sensation. It's just a quick process. The end result is very aesthetic and very appealing because we basically customize that single tooth to look like it's naturally there, like it's coming out of the tissue, and it just belongs with the rest of your teeth. So the advantage of that Maryland bridge is also a potential disadvantage if you don't like the aesthetics of the neighbors of that missing tooth. So that brings us to the next style of bridge, which would be just your conventional dental bridge. These are very common on the front, but also on the back teeth. So if you're missing a molar, missing a premolar, a lot of times what we can do is if the teeth on either side of that gap have big fillings, would benefit from having a crown, have an old crown that's either chipped porcelain, breaking down, there's a little bit of decay under there, and you have to replace that crown anyway, we can kind of kill two birds with one stone by protecting those adjacent teeth with the fake tooth in the middle. So what the process is, we come in, we get you nice and numb, we kind of prepare down those two adjacent teeth, and by prepare I mean we remove a little bit of tooth structure. So you're looking at about 1 millimeter, very, very minimal, but enough to give us thickness of our restorative material. So we remove that little bit of tooth structure, we'll make an impression, and we usually do digital impressions in our office, which basically involves a intraoral scanner. So we've pretty much eliminated the need for the mouthful of goo and the 5 minutes of waiting for it to set up and the choking feeling. Now we can do a digital scan intraorally. We send that off to our lab, and then in the meantime I make you a temporary bridge. So that day you'll go home with a temporary crowns over those adjacent teeth and a fake tooth in the middle. It's all kind of one piece. And then about 3 weeks later, we'll get you back and we will have the actual permanent bridge ready to go. And the majority of crowns we do nowadays are zirconia, that white metal, and porcelain layered on top. And the advantage of that is twofold. Number one, the zirconia is a white metal, and so when we place the margins, the edges of where that crown meets the tooth, we always place it right at the gum line or just slightly below so it's not visible. But inevitably over time, as you get older, the bone's going to drop a little bit, the tissue's going to drop. So sometimes you might see the edge of where that crown meets the tooth, But the advantage of the white zirconia is that it looks like natural tooth structure, so it's really not an aesthetic concern. I mean, I think everybody has either in their mouth or sees other people that when they smile right at their gum line, they see that darkness, they see that black line. And that's because the older style of doing crown and bridge work was a silver metal underneath and then tooth layered on top. And so that's what you're seeing a lot of times when people smile with older crowns, is as that tissue pulls back, you're seeing the edge. And it can be an aesthetic, something that's unpleasant aesthetically. But back to the bridge. So with the zirconia bridge, we've got zirconia, which is the strongest metal that we use in the mouth. So it's very durable, it's very strong. As long as you have the proper dimensions and thickness, you're not going to be able to break it. And then we've got porcelain layered on top, and that gives us the ability. I work with some phenomenal dental labs and some master technicians that can craft the anatomy and the light refraction and the light reflection and the color and the shading to really blend in and mimic your natural tooth. With the white core underneath it, it looks a lot more natural. So it doesn't look dingy, you don't have kind of dark crowns, and we can make them look very lifelike and natural. So typically bridges will span one missing tooth. Occasionally we can do 2 fake teeth, but it does get a little bit more complicated and each situation is different. One of the most common bridges we do is from canine to canine on the bottom. You know, a lot of times people will have these lower front teeth either get decay or break down or lose bone, and they start to get mobile and we lose those teeth. So it's very common to do a bridge from this tooth to this tooth with 4 fake teeth across the middle. But again, every bridge is custom. Every person we treat has a customized treatment plan. So when you come and see us, I'll talk you through your options. We can look at everything. We've got lots of pictures and models, and we can show you what specifically is the best solution for you. Along the same vein of a typical dental tooth-supported bridge, we also do implant-supported bridges as well. And that's essentially the same concept, but instead of 2 natural teeth, we've got 2 implants, sometimes 3, and occasionally 4 implants, depending on the arch and the spacing of how much we have to restore. But the implants are in the bone, and then we have a custom piece that goes through the tissue that kind of mimics a natural tooth, and then we've got the bridge that gets supported. And again, it gets cemented in place, stays in place. You just brush, floss, and clean it like your regular teeth. I will tell you it takes a little bit more maintenance because you're no longer allowed to floss in between the teeth. You have to use a floss threader or super floss to kind of go in between the fake tooth and the gum tissue and then kind of clean under there. These are all things that we cover when we go over how to take care of and clean your dental bridge. Another bridge solution that we have kind of in our pocket that we don't use as often, but it is available to us, is something called a cantilever bridge. So sometimes when you've got a missing tooth and you don't want to impact or touch the tooth next to that missing tooth, you can do a bridge being supported by teeth on the other side of the arch that kind of hang over and support that missing tooth. Because this is a little bit more involved, you have to take your time and make sure you do it right, because if you do a cantilever bridge and you put that fake tooth in an area where it's under a lot of duress or under a lot of force, it doesn't have the stabilizing balance on both sides to protect it, and so it can do damage to those adjacent teeth. So I don't say that to scare you or to say that cantilever bridges aren't a great solution. It's just something that has to be planned out, and you want to make sure you go to somebody that knows what they're doing. With so many options available for us for bridge style, design, material, it's really important to make sure you have a customized plan for your mouth. There are certain limitations and certain advantages to different kinds of bridges. You know, with the Maryland bridge, we don't want to put it anywhere where you're going to have a lot of force on it because we're asking a lot of that wing. So Maryland bridges are more cosmetic. They're more for areas where you're not going to be putting a lot of impact. Conventional bridges, when done correctly, can support tooth structure and can really function in the back of the mouth where you're doing a lot of force and a lot of grinding. And a cantilever bridge kind of falls in between there. When done correctly, you can make sure that that fake tooth isn't put under a lot of duress. You want to design properly. At the end of the day, it's all about making sure you have the right bridge and right bridge material and the right design for your mouth. Depending on where you're missing that tooth, that kind of guides us to the best decision for how to replace that missing tooth. And that same goes for materials, whether we do a full zirconia bridge, whether we do a bridge made of regular yellow gold, whether we do a tooth color bridge with a zirconia wing, all the options are kind of guided by where that tooth is, and not only that, but also your mouth and the remaining teeth. If you don't have a lot of teeth and we're putting a bridge in an area where you're going to be doing all your functioning, that's going to guide us away from something like a Maryland bridge and put us to something that's stronger and more durable and can withstand the forces that you're going to create in that area. So I know I'm using a lot of technical jargon: force, impact, function, grinding, duress, stress. But at the end of the day, we need to be able to build something that can withstand the things that you chew and eat on a daily basis. So if you chew things that you shouldn't eat, like ice, we'll cross that bridge later, it's going to cause a lot more force in those areas. So normal eating, like, carrots, steak, chicken, things that sometimes you have to really put a lot of force and grind and chew on, we want to make sure that any solution we provide you is going to stand up to the test of your diet. If you find yourself in a situation where you're missing a tooth, whether it's a back tooth, front tooth, wherever, or if you're concerned that a tooth might be going downhill and it needs to be replaced soon, come see us. We'll sit down, we'll do a very customized plan, we'll go through and look at all your options, and I'll talk you through what the best solution is for your mouth. Come see us. I'm Dr. Brett Langston, prosthodontist and owner of Dental Implant and Aesthetic Specialists, and I'm here to help you watch your mouth. Oh, look at you. Did you DoorDash that? Nice.